My inspiration for going into medicine, I think, is mostly my desire to serve my community. To me, medicine is the intersection of service and science. Both are things I really enjoy. And I think there's really no greater opportunity than to serve your community. And for a long time, I wasn't quite sure what that would be. I even considered some professions in law enforcement. I was in search and rescue for some time back on the West Coast. But I found that one of the best things we can do is medicine. And prior to deciding on family medicine, for a long time I thought about emergency medicine. There's nothing greater than being there for someone on their worst day is what I was thinking. But I found that instead of being there for someone on their worst day, in primary care you can prevent those things. So instead of caring for someone that had a stroke, being there for someone who's had a heart attack, preventing that heart attack, preventing that stroke would be even better for the community. I'm seeing everyone from cradle to grave as a family medicine physician. There's pretty much nothing in medicine I don't enjoy. That's one of the reasons why I chose family medicine, and I'm happy to see anyone. The most rewarding thing for me, I think, is the relationships I form with people. There's been a lot of talk recently about precision medicine or personalized medicine, which is looking at someone's genetic code and seeing what treatments would specifically work for them. And I think we're a ways off from that, but I do think that family medicine is the next best thing. When you get to know your patients for a number of years, you know what their priorities are, what they want to get from the treatment plan. You're really able to provide the best thing for them, and there's nothing better than doing that. One of my other big passions is integrative medicine. That's the idea that instead of just treating a disease with a medication, it's taking a step back, seeing about changing lifestyle, be that diet or exercise, and really being able to bring patients off of medications. There's really no greater feeling than to take medications away when someone doesn't need it anymore. And I'm really excited to offer that to my patients here as well. I chose Reedsburg after interviewing at a number of places because of the community. I heard from every physician, every nurse, almost everyone I spoke to again and again that this is where they wanted to be to raise their family. Many of them would leave, they would go off to medical school, nursing school, but they all came back because they knew this is where they wanted to be to raise their family. And for someone who has a family of my own, it's something that was really important to me. Outside of my time here at the hospital, I am mostly spending time trying to stay healthy, exercising with my wife and my son. We live out on Dutch Hollow, and there's plenty to do out there outside, so that's where I like to be.